And we're going to slide up with the contact and move in this direction, okay, while we internally rotate. So, start here, greater trope. Okay, I'm going to set my pressure. Once I do that, then I can start rotation. Okay, and I'm just tensioning towards sacrum. Okay, let me just talk a little bit about compression versus tension here. Because once we move, so when we're working a passive body part, if you look at the tissue orientation, if I direct a perpendicular force, that's just compression. That's really all I'm doing here is straight into it.
They get it. They get it. Smart group.
Perpendicular compression. Whatever we're doing, we have to add a component of compression. We just do to get in there. And the deeper we go, the more compression we're going to get. But when we're taking tissues through a range of motion, we don't want to compress too much because we're going to crush the tissue as we're pulling through it. Alternatively, what we want to do is get a tension on it, and that's more of tangential force to the orientation of the tissues, or parallel. So instead of perpendicular, we're trying to get this way, all right? So I was just correcting some of you. I want your shoulder behind your elbow so you can actually move this way. If you're on top of, we're going to compress. Okay, the other thing is, if you're on top of, we're going to muscle it too. I want you guys to use your body. Okay, this is just the lead into a class. All right. So let's come back here. When they're prone like this, everyone gets really confused with internal external rotation. Okay, so we're going to externally rotate again, take a contact.
So you're going from external to internal?
I'm going from external to internal.
And technically you'd be on a real plane, you'd be on skin.
Not necessarily. Because you can, for sure, skin's always best, but sometimes people on their butts, a little funny. What'll happen
I usually take it all off in the class, but today it's a little cold.
So what you guys will see, the compensation you guys will see with this motion, if they don't have enough, their knee's going to abduct. They're going to come into abduction. Okay, it's just their body's way of getting out of it. So what if that's the case? We don't let them do it. Okay, so I'm going to block him and make it much more of a pure one plane transverse plane rotation. And Lenny can tell you the difference. When I don't do that and his knee abducts, it takes a ton of the tension out. Okay?
So the key to this, remember when we were like right foot down and we're going to reach around to the right side, we need to get flexion, adduction, internal rotation. For those of you that have been to the good program, you trasma out that juncture. What you're going to find on the table now are these restrictive planes that then cause those compensations. Like when Vince was doing that, it was a night and day difference when he blocked that femur from abducting out. That's what you see in your evaluation. A person will, when you're trying to evaluate extension, they'll go through adduction, okay? Or they'll extend someone else in the body. So that's kind of where you're putting the pieces together.
And then you attack it.
Yes, exactly. And for those of you gift people, you guys understand when we're in function, and Lenny says this over and over again, we're gonna take the path of these places. We're gonna make them move through their successful motions. Different world up here, entirely different world up here. I'm looking for the most tension. I want to get the most tension I can get, is exactly opposite, out of it, because that's where I'm going to really make the transition in the tissues, when I can pull through the tension. And I talk a lot about a bow and arrow, and how a bow and arrow works is you take one end and you pull it, and you take the other end and you do that. So you'll see with me a lot. And whoever was here the other day, I don't know if you remember, I had one contact. I can't function with one contact. And I kept telling Lenny, I need my other hand to have a contact, because otherwise I don't have
floppy.
that. I'm floppy, right? So this isn't a really great example because we're through one plane. As we get through more, you'll see. But what I'm looking for here is I'm looking for this. I'm getting a bow and arrow effect, right? Yeah, that's what I want to do, and that's really how we translate the tissues. It's that. Okay, so just keep that in mind as we go through this motion. And I'm going to say it over and over again, because a lot of you are going to go like this, and you're going to go like this. And that's not getting it. I want that and that, and you should constantly, I don't care what contact it is, I don't care what contact it is, okay? we're trying to translate the tissues, and they take quite an amount of force. And you'll see as we get into some other stuff what we need to do these guys.